Hi, Kevin Henry, the Managing Editor for Dental Economics, here today with Dr. Jonathan Bregman. Jonathan's a consultant who's been to numerous dental practices throughout the country, and what we're going to talk about today are 4 key ways that any dentist can grow his or her practice. So, Jonathan, what do you see as those 4 key things that can be done here?
Well, thank you, Kevin. The first one is really, what is the mix of procedures that the dentist is doing? There are anywhere from 120 to 140 different clinical procedures that any dentist can do. And if you are in the range of maybe about 85 to 90 or so, you're in a very much of a mid-range of what dentists do. There are those that do much less, and then there are those that do a whole lot more. We could call the ones doing a lot less the referrodontists, because they refer so many of these procedures out. Could be someone who does a lot of the procedures, and that could be called a marathon type dentist, the person that really does every aspect or many aspects of all the procedures. Where that comes into play is, instead of referring out the endodontics and referring out some soft tissue treatment, or even some really minor periodontal type things, or some surgery, instead of referring those things out but keeping them within your practice, that you can keep the dollars in. And I personally never met a patient that would rather go out of the office. They all want to stay with the dentist, and because that's where the trust is, not with a specialist or someone else.
Okay.
So that mix of procedures is really critically important, and it doesn't change overhead. It changes actually very little, because we do more procedures, we offer more of a service, and we have to let our patients know that we're offering these things. That includes cosmetic services as well. And if someone has been referring, endodontics is a good example, endodontics for a period of time, they may choose to take an update course. They may possibly choose to invest in some kind of a mechanical endodontics system. But it's not that hard to be able to get back up on track online with either a procedure that you used to do, or to take some courses and become comfortable with some procedures that you can add in that maybe you never really did very much throughout your practice years. Okay. I think in these economic times, that could be a really great way to help to grow your practice. Okay. So adding to your mix of procedures that you offer, I think that's definitely one. How treatment planning is done, I think, is another one. And I think it also relates to how the new patient comes into the office. Are you trying, is the dentist trying to present a fairly complex treatment plan to someone within a tiny time frame, within either the initial visit with either the dental assistant with the doctor on one side, or the dental hygienist and the doctor on the other side, instead of finding that point where it's known in the office, we need to have this person back for a treatment consultation, gives the dentist time to really study it, fees to be worked out, possibly models taken in advance and some study done, so that there's really an effective treatment plan that's presented that could be also done in phases. I think a lot of dentists lose out on that opportunity to get that understood. So I think treatment planning is a big thing, and built into the treatment planning that the dentist is doing is the aspect of treatment planning for the hygiene, definitive periodontal hygiene procedures, kind of build into that, how it's coordinated with what the dentist is going to do. So I think that would be the second one. So the first mix of procedures, the second one, treatment planning, and I think the third is to step back and to say, what are we giving away? Dentists, many dentists are very kind, very generous people, and give away a lot. Don't charge for things that they should be charging for legitimately that they're doing. And I think a part of it could be that breakdown in getting information from the clinical part to the business office, that it's not listed, the patient is not told, and therefore when the treatment is done, they don't want to surprise the patient so they don't make the charge at all.
Okay.
And it could be just not thinking through the fact that you may need to be doing some additional procedure, and it's appropriate and it's okay to charge for those things. So to be very careful and choose what you're going to give away. And if you give something away, let the patient know that you've given it to them, and let them know the value. Here's the procedure, here is what the fee would normally be, and there's a professional courtesy that we're subtracting it out. If you're going to give it away, let them know what it is that they're giving. I think one very strong example are build-ups under crowns. Most every dentist, dental assistant, business office person who knows about dentistry, you look at a tooth with a very large filling, you take out that old filling, it's going to need some kind of a foundational build-up. And commonly those are given away without even letting the patient know they're being given away. So that may be one very good example. And I've seen offices and encouraged offices, if there's any question, include it. Include it in with the fee, and if you don't need to do it, what a treat to be able to tell a patient, we thought we might need to do this, but as it turns out, we can do this just as well without that buildup, so it's that much less,
Okay.
so the fee actually goes down.
Great.
So that would be the third area. And then the last one is also a really very, very important thing, because what we have our most value in as the dentist is our time. How are we most effectively using our time? And looking at time, to me, and from what I've learned over a period of practice years, is doctor production per hour. What is the doctor really producing on an hourly basis? How effective is he or she within any hour time? The second piece of it, how effective and can you maximize the appointment time that you have? So are you going to work in multiple quadrants and be comfortable to do that, so that you can do 3 fillings in one sitting? They may be in 3 different quadrants, but that's so much more of an effective way of treating someone for that patient, but it's also a much more efficient way for us to use our time. Is there really a maximizing of the skills that the dental hygienist and the trained dental assistants have that legally they can do? Are you maximizing those things? The dental assistant can place retraction cords and make provisionals. Are you setting your time with that patient so that you turn that patient over and let that assistant or hygienist do that part of the treatment, and then you go on and do something else that will maximize your time? So it's really a few different areas. One is, how do you treatment plan effectively so that you give the right amount of time? Are you treatment plan in a way that you can maximally use the time the patient is there? Are you utilizing the other team members who can help you as the dentist be that much more efficient and effective in the work that you do? So I see those 4 areas to be really key. The mix of procedures, the treatment planning, how is it done? And is it done effectively? Is it done in stages and phases? And what are you giving away? And stop giving it away. Or if you do give it away, let them know what the value is. And then what is your time efficiency? Are you maximizing doctor production per hour and doctor production per appointment?
Sounds like 4 great tips. All right.
Yeah.
Thanks, Jonathan. Appreciate it.
Okay, thank you.